Thank you very much, Ivan Walnyolo, reporting from Entebbe. Well, the hospital is full at capacity after the cases over there skyrocketed from 3. Yes, you had me right, to over 127 right there. So we do have Dr. Olive Kovsinje. She's the author of The Patient, a book that highlights the plight of the medical workers in Uganda, and she joins me right here in studio. First of all, let's comment on what is happening in Entebbe. The doctors right there, the hospital is full to capacity after the cases skyrocketed from 3. Now, what do you make of such a situation? Low availability of PPEs. How is that actually making it so impossible for our health workers to actually go ahead with their work? Before we get into all the nitty-gritties of Heroes Day, let's first talk about this clip.
Yeah, so it's very concerning.
Yeah.
And in some ways it was to be expected. We all knew that once the lockdown started being lifted somewhat, that there was going to be some level of community transmission. And so I think we were all anticipating that there might be an escalation of cases and patients. But yeah, you're right. With that anticipation, we should have been even more keen to make sure that the protective equipment were available, that health workers had been sufficiently trained, drilled, so that there was, I mean, we had sufficient preparatory time. So I think currently we shouldn't be dealing with PPE. That shouldn't have been a concern at this point. That we should have taken care of a long time ago. As we would have the numbers of health workers in those places, because again, we could have anticipated that this would happen, that we'd need more health workers of different kinds of levels of training. Yeah.
All right, so we're going to get into that conversation wholesomely. But let me just give my viewers a preamble into this conversation. Today is Heroes Day, and here at NTV, our heroes are the health workers who actually have been on the front line as the country battles COVID-19. To speak to us on this Heroes Day, we do have Dr. Olive Kovsinje, the author of The Patient, a book that details Uganda's healthcare system through the eyes of 3 letter to friends. Well, Rama Monyo from the Civil Society Budget Advocacy Group will also be telling us if and only if we should have hope that the gains from the COVID-19 pandemic will stay with us after COVID-19. Will we forget the positive gains? Well, he will be telling us. And Mr. Mwambutse Ndebesa, he's a political science lecturer at Makerere University. Well, he will also be telling us what comes to his mind, yes, when he read that this year's Heroes Day is going to be attended by only, guess what? 30 people. That's half the number of people that attended Martyrs Day. There were only 60. Well, thank you for joining us, Dr. Olive Kovsinje. Let's delve into the Uganda marks Heroes Day. You know, we usually commemorate those heroes that acted exemplary and sacrificed their lives, you know, showing us the patriotism, the sacrifice. You know the whole story. But then I would like to know, what does Heroes Day mean to you?
Yeah, so Heroes Day, in some ways, it's a curiosity on our calendar, because what is its history? I think that it has its history in military heroism, in the idea that the people who went to war were the heroes, that they rescued the rest of the country, and to a great extent they did. But I think it also, as a result, has come to mean that a few individuals somehow on their own are able to go ahead of the pack and do all of these things. And although over time Heroes Day has come to, you know, the awards on Heroes Day, medals have gone to, you know, different kinds of people and not just the military, I think that history hasn't entirely gone away. And so I think when you say, what does it mean to me? I think that a lot of, that not just me, but I think a lot of Ugandans recognize that in the idea of a hero is someone that is sacrificing, that there's sacrifice, that there's concern for other than self, over and above the ordinary, and that person, the hero, will then go the extra mile with a level of sacrifice that is not just, oh, you know, you're a great journalist, so you're a hero, but that maybe you go to the extent that you really want to represent these people, to make their voice heard, that you put your life at risk, which I guess is why people are saying, people like yourselves, that maybe medical people in that regard, are also heroes.
Not maybe 100%. The medical heroes that we are highlighting today are, you know, our medical workers right there. And often times during this global pandemic, you've had the doctors and nurses at the heroes. You've been invoked as heroes, by the way, all over the world, not just here in Uganda. Get it from me and many Ugandans out there. They really believe that the medical workers in this season of COVID-19, you've been our heroes. But then I would like to know, how did we come to this place? Help us understand that.
Yeah, so this metaphor of us being at war, being in a war, and so having, you know, people in the trenches on the front line, it's the global narrative. You know, everybody says, you know, who's on the front line, and nobody's, you know, wondering, because we are battling a pandemic. It's a serious health threat, so health workers are then the ones that are on the front line. And so I think while that is clear and not being debated, I think when we step back and say, okay, so then if that's the battlefront, and if those are the frontline workers, where are we putting our resources? Is that really where we're putting our resources?
That's the question now.
Yeah, if this is going to be where we sink or swim, if this is going to determine our success, then maybe we need to really put our money where our mouths are and say, if these are the heroes, if these are the guys in the trenches that are going to pull us out, this is where we're going to put our resources. This is
and in your assessment, is this happening? Is government putting all its resources to the medical workers to ensure that you do your work wholesomely?
I think there's been an effort, and by the way, this is not just in Uganda. I mean, I've seen reports from lots and lots of countries, especially those countries where which were hit by the pandemic before us, and so they've also had their battles about, you know, whether medical workers are well resourced, whether the health care systems were sufficiently resourced, and so on and so forth. But coming home here, I think with that preparation, we could have done a much better job. And I think that even when you look at our budgets, the biggest chunk of the money is not going to health. It's not going to where we think the battle lines are. It's some of it going to security, some of it going into politics, some of it is classified, so we don't quite know where it's going. You would think in a pandemic that things should be transparent enough. I mean, that.
Of course, the Defense Ministry plans to spend almost half of its budgetary, half of its budget on actually classified expenditure, purchasing military equipment. So many people are wondering, shouldn't be at such a critical time the government should prioritize the health workers and maybe bankroll you with more money so that you can purchase the PPEs that you need and get on with the work that you're doing instead of focusing on security. Who is keeping the country secure? Is it the health workers? Or the army?
So we get it. We get that security is important.
Yes.
We get that there are security threats sometimes. I think what we don't get right now is that if we are all agreed about where the battle is and what the battle is, then we clearly are in different battles. You know, I think those people that are fighting the pandemic, that are ensuring that the populace is protected, that people are protected to the extent possible, that their immunity is being built, that those that are falling sick are quickly being identified and being treated and being taken out so that the spread is minimized. The people that are doing all those things, you would think are the priority, not according to the resource allocations. And so if we were to say, how are we managing, you know, our heroes? How are we resourcing our heroes? I'd have to say that maybe we are not talking about the same war. We still have health workers that are struggling to survive, you know. So I'll tell you something. In ordinary circumstances, no pandemic, no curfew, no restrictions on transportation, a lot of health workers were doing more than one job in order to make their ends meet. So you would have nurses, doctors work a shift of 8 through 5, and then dash across town to a clinic so that they could feed their children and pay their rent. So when you have a curfew, when you have transport restrictions, it means that they really can't do that, and so they fall back on their one salary of maybe 500,000 a month. And how far does that go? So you have a very stressed out workforce that is barely making ends meet. And so when they hear that there are going to be allowances, there's a sigh of relief. Maybe there's going to be a little more income. And then it doesn't come, or it comes late. And when it comes, it's a pittance. And really, these are the people, we want all their focus to be on taking care of people's lives, or figuring out where is the virus, how is it spreading, how can we control its spread, or figuring out how can we make sure that isolation works well, how can, and being protecting themselves. Because a lot of times, I think people think about protecting health workers for themselves, and that's absolutely right. But they forget that actually health workers can also be a channel of transmission back into the community. So that if you want to limit your spread, you're going to have to look to take care of the health workers for themselves, but also just so you don't have hospital to community transmission.
Indeed.
So all of those concerns, you have a health workforce that is going to battle all that is working 12-hour shifts, and yeah, they're not being paid enough.
So how has such a callous working environment made it so impossible for our health workers to go on and do their work effectively?
So they try, and that's why we say there's a lot of sacrifice in in healthcare. That many of the people that work in healthcare, not just the doctors and nurses, but everybody else that works in that setting, that they really work, most of them sacrificially. That most of them are at the top of their game in terms of being professional, of putting their work, above their comfort. But I think there's got to be a limit. So, you have lab technicians that people don't ever see because they're in the laboratory doing their tests. You have people that work in, imaging in X-ray departments. You have cleaners. Do people ever wonder who makes all this ugliness go away when, you finish stitching patients, or you've, sucked out stuff? So all of those people that work in that setting, they're at great risk of contracting illnesses from their workplace. Unfortunately, they don't have sufficient protection.
Wow. How will we remember the courage, the duty, and the sacrifice of the army of COVID-19 frontliners who are working to keep this country safe when the world is well again?
So when the world, so everybody says, when things go back to normal. But I think eventually people are realizing that, well, maybe the new normal is not entirely the same as what we had before. And so sometimes that can be frightening, not quite knowing what it's going to be like, and none of us knows, what exactly it's going to be like. But I think we can also look forward to certain things being better. So for instance, we can look forward to people having a better understanding of what their healthcare workers go through, and so why they need to be to have better care themselves. A lot of healthcare workers, actually, when they fall sick, they can't quite afford a good hospital. They can't quite afford the care that they need. So we'd be looking for that new normal to be that we don't debate about healthcare coverage for health workers, about decent salaries for healthcare workers, about decent working conditions. Did you know that there are hospitals, health facilities that didn't have running water?
Yes, that used to happen.
Absolutely.
It was happening even before the COVID-19 took center stage.
We would hope that.
So that's why we were so worried.
that ceases. We would hope that that's history. That we will, one day we'll tell our medical students that, by the way, don't take this for granted. There were times when we didn't have water, or maybe we didn't have stable electricity. We didn't have to use, people used cell phones to finish an operation because the electricity ran out in the middle of an operation. We would hope that those kinds of things cease.
Wow. So will nurses, doctors, and other carers actually be revered like the military when we are writing history about the COVID-19 pandemic?
So revered, I don't know that that's going to happen, but I think that treated in high regard. Yeah.
Indeed.
I think that surely, because listen, so when you have a country that with a population like ours, where we've been moving towards universal health coverage, we haven't quite gotten there, and I'm not, so we are moving towards it. You have a country that's been moving towards middle income status. Marking time.
We backtracked a bit.
Yeah, and I think we probably going to lose some of the gains that we had, you know, with the lockdowns and all of what that has meant for the healthcare system, but also just for the population.
Welcome back, and thank you for staying with us. Of course, we are highlighting the might and the plight of medical workers as we actually veer through this very, very contentious period of COVID-19. I do have Miss Dr. Olive Kobusinje. She's the author of The Patient. I also do have Mr. Omonia. Yes, Omonia Rama. He's from the Civil Society Budget Advocacy Group, and he also joins us on set. A very good morning, Mr. Omonia. We are discussing Heroes Day. Well, what does it mean to you, besides the whole commemorating people who sacrificed their lives for this country? I'm talking about the guerrilla war, but then in your own words, what does Heroes Day mean to you now that we are grappling with COVID-19? And who do you think are the heroes this season?
Thank you very much. Good morning to the viewers. It's a lovely morning, a bright one, and we hope it is also bright for the health workers and also other heroes elsewhere. President Trump described himself as a wartime president because of the global pandemic, and I know other world leaders say the same. In Uganda, the president has said we have been besieged, we are under, we are in a war situation. And if we are in a war situation, who are the frontline soldiers? Certainly they are the health workers. And globally, if you have seen the response to this pandemic, the health workers has been on the front line everywhere. In Italy, I think the numbers that were lost, medical workers who are lost to this pandemic were, I think, well over 2,000, quite Indeed. A big number, both doctors and also other health workers. I think globally the number could be somewhere, I think, between maybe 5 and maybe 10,000. And that's a big thing. So they put their life into risk every time they wake up, to go to work. Yeah, the risk factor exponentially increases by the kind of, diseases, they interface with. So for me, I would want to think that the health workers, not only even during this pandemic, should always be our heroes at all times. Because all of us, truth be told, you get sick at one point.
Indeed.
And when you get sick, even medical doctors themselves say, no, you don't treat yourself, so you have to run to a health worker. So a health worker in any form is a very important person and must always be celebrated. Not only today is a Heroes Day, but must be celebrated every day. And that celebration should always translate into how their welfare are taken into account, how their work is resourced, how they're equipped, and all that because of that. Because any small mistake for them, it can cost, life. We remember the Dr. Tim, the mother to Dr. Tim, who caught HIV, I think, in the early 90s when she was operating a soldier, and because she, she didn't have some protective things, and the thing, got a prick, and she contracted HIV. So doctors and medics world over, always operate in a risky environment. I can only equate it to special forces who are always operating behind the scenes at all times. So they're very important. I celebrate them every day. So and by the way, I also come from a family where the mother was a medic. So I really appreciate, we used to have her running throughout the night. We never had our mother for most times because she has to attend to people. So I really have a very personal experience, and I really appreciate them.
Amazing input. But if the medical workers are our heroes this season, why isn't that being reflected from the side of the government to actually give these health workers the equipment that they need to go ahead and do their work? Why isn't that being reflected from the government? And why has government been so adamant to actually give these medical workers the needs that they want?
Let me put it into a bit of perspective, the global perspective. Globally, we fund more military and war-related ventures than medical aid. Than medical fields. Last year, 2019, I think the Stockholm Peace Institute indicated that we spent about 1.9 trillion in the military warfare, but we only spent, I think, about 250 billion, in public health. Yeah, public health. Leave alone the private health and all that. Public health, because military also is public spending. So we compare public spending against public spending. And if you look at even the R&D component of it, even comes lower. The R&D, you know, globally, I think we are around 28 billion, you know, dollars, US dollars.
Research and development.
That is globally R&D. While for military R&D, yeah, military R&D only, we are in over 250 billion, just research and development. So it's very skewed globally how we look at health. Now in Uganda, I think for a long period of time, from around 2011 up to around 2018, 2019, our spending has been around 7.2% on average. In 2001, we made a budget declaration and said we need to spend about 15% of our budgets in the health sector. But now we are spending on average of 7.2. The current budget, this current year, which is ending, we have about 2.5 trillion, and the 2021, which is next year, we have 2.7 trillion. And to know why this is important, when the budget framework paper was issued in December, when it went to Parliament in December, we had only 1.5 trillion in our health sector budget. Reason being, most donors hadn't committed to funding our health sector. You know, we get a lot of funding from the health, from the donors. Without them, I think we would literally, I can say with confidence that most of the programs under health would literally collapse. Because what our government pays for are largely wage and non-wages. But the programs under health, be it TB, be it malaria, be it, child mortality, infant mortality, maternal mortality, most of those programs are donor funded. And it's a huge, gap growing. As we continue, going towards 2022, 2023, when we are supposed to review our health financing strategy, I think we are seeing more increment in the in the donor funding. And this is even reflected in that very strategy where they say that the elasticity in growth of funding or financing the health sector is largely on account of donor funding than as a result of locally generated revenue to finance our health sector. So generally what we pay, what we do is to pay our health workers salaries. We also make sure that they have some conducive environment to work, but that money is always little. It's not sufficient. They cannot equip them very well. They cannot buy the medicines we want. They cannot even pay them very decent salaries, by the way. So largely, probably that's why, maybe the reason is we have a limited resource envelope, so we say. But I think the major concern for me has always been, how do we apportion resources within the budget, first of all, but also within the sector budgets, how do we apportion resources? Yeah, there is always a mismatch between what we claim we want more resources and also wastage of resources. I'll give you an example. In 2017, the Ministry of Health had about 295 cars, vehicles, known, because there are also some which are unknown because the logbooks have been hidden and all that. And we were spending about 6.5 billion shillings in repair and maintenance alone. Okay? Now, during this pandemic, the president said we need to spend, we need about 1,350 cars. That's about 10 per district. Okay? And if you look at that, how much would be the bill, the total cost for that? Yeah? And how much would it take away from the welfare of the health workers? How much would it take away from the buying of the equipment, the protective equipment and all that they need, for them to have decent working environment? How much would we be taking away from purchase of medicines and all that? Yeah? So we need to rethink how we do our budgeting and also prioritize some of the health issues. We may not reach the 15% budget declaration in a long while, but I think within the budget itself we need to prioritize certain things. If we go prioritizing vehicle and equipment purchase, which is good, by the way, for the mobility, but what are the maintenance? Every time I travel outside Kampala to districts, I go to the yards of parks. I have pictures here. Some of them you have been seeing on social media. They are actually mine. I take those pictures to see dead cars, but looking very good, and how much capital is actually hidden in that, which could have actually been used to help, in financing the health sector much better. So when we talk about health finance, health sector financing, we need to be alive to what are we really talking about financing. We could be saying add more money to the health sector, which is true, and most of my advocates keep saying that. But what if you add more money and then they buy more vehicles only to die the other day?
Like what has been happening.
Exactly.
And on the same note, on that issue of health sector financing, is it an issue to do with the thin resource envelope, or is it a lack of political will to go ahead with the same? Because I'm not sure that the viewer is buying this, because a few days ago, Dr. Kizza Besigye also came out and said trillions of shillings were not spent in this elapsing financial year. Couldn't that money be given to the health workers? So that's where I come in and I ask you, is it no will, political will, or is it a thin resource envelope?
That's very true. The unspent resources across government is huge. There is hard to get the accurate figures because sometimes some monies are committed and appears unspent and all that. But in the health sector, one of the biggest contributors of unspent finances is attributed to issues to do with the low staffing capacity. By 2017, we had across the country, we had, I think, a staffing gap for the lower medical workers, apart from the doctors and all that. We had a staffing gap of up to about 45%. 2017. The number could have increased between then and now because we have made some recruitments and that, but that was it. And so when you put some money into the budget and expect it to be spent, and then there are no people to actually spend it well, how do you expect it, to happen? So we need to address several issues around that. By 2013, we were losing about 26 billion shillings due to absenteeism of health workers. And what were the reasons for absenteeism of health workers? Some of them were issues to do with hard-to-reach areas. You have very many, remote health centers, and you are not remunerating these health workers well, and you want them to appear there every day. Some have to ride their bicycles long distances and all that. So they were absenting themselves, and we were losing that. I do not know the figures right now, how much we could be losing, because I still believe absenteeism
But it was
exists.
happening, yes. We also got the reports.
Yes, so the question of how much of either we are not putting so much money in the health sector or we are not spending so much, is a question that requires a broader analysis.
Okay.
But capacity is a big issue. Equipment for these health workers to utilize. If I'm a medical worker, I wouldn't go to work without gloves. I can tell you in many of the health centers that I've been to, whenever I take a visit, I see them, they tell you I don't even have a basic equipment like gloves to handle patients.
Indeed. Let's now talk about the impact of COVID-19 on our health workers. Now, globally, I was reading a report from the International Council of Nurses, and they were saying that the number could be between, like he said, 5,000 to 10,000. But that was according to some statistics from only 30 countries. It was only 30 countries out of over hundreds of countries that are represented by the International Council of Nurses. So they were saying the number could be between 200,000 and 300,000 infected medical workers globally, if you're going to put if you're going to tally all the 194 member states of the World Health Organization. Now, back to Uganda. We understand 22 health workers have been infected with the novel coronavirus, but help us understand how dire the situation is. With the low availability of PPEs, could we see numbers of health workers contracting COVID-19 skyrocket in the near future?
Well, so we haven't tested all the health workers. So the number that we have is of those that have been tested. So if we were to test more, they could be bigger. They could be bigger numbers. But also, the kind of conditions under which they work, one can see why the infections might increase. So in many centers, they've done different things. Some of them are taking longer shifts. So a health worker will work for 12 hours. Now 12 hours, the first maybe 6 hours, they'll be really on top of it. And maybe as they begin to get exhausted, a few things will begin to slip. By the 11th hour, they might, not quite be as attentive as they were at the beginning of the shift. So longer shifts put more health workers at risk. They are more exposed. If numbers begin to escalate, the number of patients that they're working with, that they're dealing with, that also increases their level of exposure. So again, that could result in health workers getting more infections.
Yes.
But infection with the coronavirus, terrible as it sounds, is not the only thing that's happening to health workers. Health workers, before we got into the pandemic, have a much higher rate of, for instance, suffering depression. You know, there are a lot of suicides that go on amongst the health
Mental
workforce.
health is rife, yes.
Mental health issues. So when you have this now compounded with a pandemic, as I already mentioned, many of them were working 2-3 jobs in order to make their ends meet. Now they don't even have that because they're not as mobile. They have their kids at home, not in school, so they're worrying about the supervision of their kids. They're worrying about if they might carry the virus to their families. So there are many reasons why health workers actually now are much more stressed than they ordinarily are. And so that mental health burden.
Let's exhaust all those challenges because the authorities are watching and might do something.
And might do something,
yes.
yeah. So there's a lot that we can do to lessen this. And again, you know, so they have that. They have the fact that they are at risk of contracting the virus. But they also have other health issues that they might have had before. So I think we need to look at the health of the health workforce in totality and not just look at, oh, have they contracted the virus? Because there's a whole lot more going on.
Wow. Ms. Omonia.
By the way, I think less than 10% of the health workers in Uganda have access to health insurance, for example. That means majority of them, when they fall sick, they also become, they also go through what an ordinary Ugandan goes through, you know, to access health services. And that's a big issue. There has been conversation of how do we scale up what they call risk pooling, which is basically health insurance, and to extend it to health workers as a priority, because you need to have a healthy person looking, treating after a patient.
Indeed.
If you have a patient trying to treat a patient, then you have a double dose of a problem.
That's a
and
disaster.
That is where we are not making a lot of inroads into it. We have the National Health Insurance Bill has still been gathering dust in Parliament for many years. But I would think even before that bill comes in, government can take a proactive step. There are so many health service providers, insurance providers today that can be given some money to put most of the health workers into this health insurance scheme, so that first of all they're healthy before they can begin thinking about treating other people. And we are not doing that, and that's very alarming. So for me, every time I go to a health center, I would want to be comforted that the medic treating me is a healthy person, both mentally, like Dr. Kobusinye says, but also, you know, physically. If that is not the case, then I can also have worries about, you know, what is being done to me.
Dr. Kobusinye, what ought to be done by the central government to actually ensure that our health workers are protected and they're doing their work without any challenges? Recommendations.
So the health workers have representative organizations, associations. For instance, doctors have the Uganda Medical Association, and the Medical Association has come out with a very clear plan and recommendations on what needs to be done for health workers to be protected, for them to be empowered, for them to be, you know, for their well-being, so that they can now take care of the well-being of other people. There have been engagements between the Uganda Medical Association and the Ministry of Health and government. And this is not recent. It's been over years. A lot of times promises are made. I think you might recall that some 3 years ago, maybe 3 years and a bit, health workers threatened to put down their tools. And so they were threatened, they were told that it was an illegal strike, they were told they were going to be replaced by Cuban doctors, and a whole lot of other unpleasant things were said at the time. But really, all they were saying was, there were two things. They were saying, pay us decent salaries so that we can focus on taking care of patients and improve our working conditions. Give us the tools that we need. Make sure that the areas in which we work are the kind of areas where you as a patient would like to be treated, and we as medical workers would feel proud to work. Now, those requests, basic and reasonable as they sound, were not met. And after a lot of negotiations, they eventually signed some sort of agreement where the president accepted that they were going to actually increase their salaries. 3 years on, that has not happened. So you still have a medical doctor that at the end of all of what they've gone through with training, with their long working hours, a medical officer takes home about 2 million. If they're paying rent, having transport, food, looking after their children, how far is that going to go? You have nurses, you know, a registered nurse. This is probably the largest number of health workers we have in the country, are registered nurses. This is the commonest type of nurse. Incredible people, very committed. They take home about 500,000 Uganda shillings. And we expect them to be at the job to do all that we need them to do, day in, day out. So the kind of things that we need. So I think we need to settle those very basic requests that they've made. And of course, then we can put in, as he said, measures so that when a health worker now becomes a patient, that they're quickly taken up, that they don't have to worry about their own health care, that they have sufficient and ready access to mental health services when they need those services, and that they're not stigmatized for not copying and all that. So I think there's a lot, and I think that the Uganda Medical Association, especially for doctors, and I'm sure the nurses have done the same as well, have put these requests on the table, and I think we need to look at them critically and begin to walk the walk.
Begin to walk the walk. Of course, Ms. Omonya, the requests and recommendations highlighted by Dr. Olive Kobusinji sound like a no-brainer, 100%, a no-brainer. But why is it so hard for government to implement the same?
In early 2000, World Health Organization commissioned, I think, a global study. I forget the exact title, but it was something like the macroeconomics of health. And the key thing they said is, invest substantially in health and you will do better in the economy. That was the little summary they had. Right now, our biggest challenge is how do we balance the priorities that we want? We want to put more kilometers of roads, we want to put energy, we want to do all this security and all that. But one of the biggest challenges we have with the health sector planning and budgeting and financing right now is the issue of the external financing. I can tell you, to a health, to an accounting officer in a health sector planning for next year, they always have no idea what is coming. Because as they sit to start planning in September, they don't know how much money is available because the donors have not committed money into that. So our government must take charge of this and say, if the donors bring in more money, well and good. But let's take charge of what we want.
So we are at the mercy of the donors now more than ever.
For most of the programs.
So if we look at $100 that go into health, the donors might pick up 42.
Yes.
Government might pick up 15. The rest of the money is coming out of people's pockets. And that includes health workers' pockets.
Okay, hold that thought. Hold that thought. We are now going to link to Mulago Hospital, where my reporter Stephen Mbide is standing by to talk to some of the medical workers who are on the front line battling COVID-19. A very good morning, my brother Stephen Mbide. What's the latest coming in from Mulago?
Yes, morning, we know that today is Uganda Heroes Day. Many people use this day to commemorate or celebrate those people who are putting their lives at stake, those people who are doing everything it takes to live whatever it takes, but to save lives and put their lives at stake. And here at Mulago Hospital, we know that during this period of COVID-19, fighting this pandemic, many people are praising and worshiping health workers who are putting themselves at the front line. And here at Mulago Hospital, I'm going to be speaking to some of these people you've been worshiping, praising for at least fighting this COVID-19. There are many, these doctors, the professors, the nurses, and all the health workers are doing their best to save a living, or save a life. Good morning to you.
Good morning, sir.
What's your name?
Bonimpa Nelson Robert.
Are you a doctor? Are you a nurse? What's the position here?
I'm a nurse.
Just tell me, today we are celebrating the heroes, and we at NTV are celebrating you, the nurses, the doctors. How do you feel being one of the people who are putting yourself at the front line to save lives?
I feel great. I feel I'm a hero because I've offered my life to save the lives of COVID patients. I also feel great because it's a scaling condition. At the beginning, I feared the condition, but we are here to save lives. And that's why we feel we are heroes of this nation.
Okay, thank you. Good morning to you.
Good morning.
Your name, sir?
Bruce Chirenga.
Mr. Bruce Chirenga, many of the health workers, the other day we saw at the KCCA, some, and also across the country, some health workers have also been victims of this pandemic. They have contracted this disease. How do you feel, you putting yourself at the front line, don't you feel scared that maybe you could be one of them?
Yeah, definitely someone has to be scared, but the protection that is available, the personal protection, if used properly, it can provide you protection. So in a way, knowing the science behind this protection, I am not scared.
You're talking about the protection, someone knowing the protection, but we've seen some people reluctant. Even the other day, government was saying there is some complacency. Don't you feel that this is a big problem within our society, that people are getting complacent?
Yeah, the people are getting complacent, but as health workers in the hospital, we keep reminding ourselves almost every day, and on each duty there is someone in charge of infection control who conducts surveillance to see that everyone has used the protection very well. So I think if that is followed, we are fine.
Thank you so much. Let me speak to another health worker who is also putting his life at the front line to save many lives here. Good morning to you.
Good morning.
What's your name?
Mark Chizito is my name.
Okay, just tell me, you also a health worker here at Mulago. So many across the country, because we know that many districts now have this problem of COVID-19. You are the health worker. So many people are saying that these health workers need to be paid highly because they are doing whatever it takes to put themselves at the front line. What do you think about remuneration for the health workers? How should it be handled in Uganda?
Well, definitely we need to think about paying them highly, of course, depending on what is available. And that is a discussion that can always go on. But the most important thing is that for the ones that are putting their lives at risk, saving the COVID patients, they need an applause from the community as well and the country at large, because they are the true heroes.
Okay. Thank you so much. Let me also speak to someone else. Good morning to you.
Good morning.
Your name, sir?
Preach Kabata.
We are, as Uganda, we're so lucky. So many other countries have lost so many patients due to COVID-19, but Uganda, due to your services, we've not lost any single patient here in Uganda. How do you feel about that?
Well, it's a great relief, and I'd like to thank all my colleagues for their hard work. And indeed, we also thank God that he has been able to preserve our patients. Yes.
Thank you so much. And the lady, the first lady here on Morning at NTV, good morning to you, live on NTV.
Good morning.
Your name?
Dr. Doreen Nanyunja. Yeah.
Dr. Doreen Nanyunja, you're also part of the team that is helping saving lives here in the COVID-19 era here in Mulago. Today is Heroes Day, and we're celebrating you as NTV. How do you feel being part of the heroes of Uganda, as many people are praising you as our heroes?
Well, it feels great, but I think medicine is a calling. So for us, this is our day-to-day life. I don't feel like we are doing anything extraordinary, though, of course, we are in a situation where everyone's scared because there's this new disease. But I'm grateful for NTV to highlight the plight of the health worker, and I think we shall continue serving as best as we can.
Every time you are discharging patients here, many people see you dancing and praising, and many young people get inspired. What would you tell those who are in school and they would like to be doctors or nurses in the future? Because they see you, you're lively, you're happy, and you're serving the nation.
Well, those who want to join the profession, it's basically a passion. So if you love to take care of people, love to take care of patients, you go for it. It's a long journey because you have to really read books for a long time. to become a medical professional. But if they really are passionate about it, they shouldn't give up along the way. They should pursue their dream.
Okay. Thank you so much. There are also other health workers here, the professionals here. They're waiting. I'm sorry I just interrupted them. Were here in a meeting before. I had to also have a word from the director of Mulago Hospital, Dr. Batirana, who allowed me to interrupt their meeting here because, yes, we know today is the Uganda Heroes Day, and we want to celebrate them because they are doing a lot of good work here in Uganda, but also in the region. Good morning to you.
Good morning, sir.
Today we are celebrating the heroes. You are our heroes as NTV because you're putting all that it takes to help save lives.
Thank you, sir.
And you just want to understand from you, it's not only coronavirus that is ravaging Uganda, but there are also some other diseases. And maybe Uganda seems to be, do you think Uganda is neglecting other diseases? And the attention is now put only on coronavirus. Yes, you are here, you see very many patients, but do you think there's other diseases are being neglected in Uganda today?
No, sir. Actually, as it has always been, it is service above self. While we are here, we're focusing on corona, but as well as other patients are also coming for our services. So it is interactive. We take care of the corona people as well as other patients that come into the hospital. So we've not neglected them. We are taking care of them as well. Yes, sir.
Thank you so much. Let me also, as I wind up this conversation, let me just have a word with the director of Mulago Hospital, Dr. Batirana, who is already here, was chairing this meeting of the health professionals who are saving lives here in Uganda, but especially here at Mulago Hospital. Good morning, doctor.
Morning to you.
Yes, I found you here chairing a meeting. We are here as early as 7 a.m. to save lives, and today is Heroes Day. How do you feel being part of this team that is at least championing the fight against COVID-19 in Uganda?
We feel good because we are health workers and we are born, educated to serve human lives. To save human lives, serve them, repair them, and that's exactly why we are here. Although some of the diseases are not the best because they are highly contagious and sometimes fatal, but we do our best to put our lives in front and save other people's lives. Because if we all run away, what would happen? People would just die.
Finally, what is your last word to Ugandans as they continue with this fight of COVID-19?
The responsibility to keep alive is the individual's responsibility. So every Ugandan should try to make sure that he or she doesn't get COVID and must keep healthy and alive.
Thank you so much. Dr. Batera is the director of Mulago Hospital. I would love to have a conversation with all these gallant service persons of Uganda who are putting their lives at stake to save lives, especially now that we are battling the COVID-19 pandemic. But, of course, I have to allow them and let them continue with their meeting, and I have also to get back to studio for Romeo Busiko, who is there. Stephen Imbido Fefe Suechuga now handing you back to studio for Romeo Busiko for the rest of the conversations here on Morning at NTV. Keep it here and happy Heroes Day. But of course, I have also to celebrate my mother because she is having her birthday today. You, my hero. First and Abaseruka. Back to you, Romeo Busiko.
Thank you very much, my brother Stephen Mbide. Very beautiful scenes coming in from Mulago Hospital. I also do have Dr. Olive Kobusinje in studio and Mr. Omonya Rama from the Civil Society Budget Advocacy Group. He's about to leave us, but then I do have this last question for you, Mr. Rama. Now, the president did mention during his State of the Nation address that he mentioned during that the NRM had their 10-point plan. Now, the fifth plan is to create an integral, independent economy and sustainable economy. But then what you said is that the healthcare system in Uganda is actually banking on money from the donors. Doesn't that contradict the president when he says that we have an integral, independent and sustainable economy?
Very interesting.
In a minute.
Very interesting idea. There's a clip going around about Keith Muhakanizi, the Governor Bank of Uganda, and I think some other person in UK or one of those capitals, trying to negotiate for some funding. And one of the things they were pushing for was more funding into health, into education, while the president wanted more money into the roads. Now, the question of health and integrated economy and all that is like a chicken and egg thing. Everybody wants to ask, should I put health first, then economy will come, or should I put economy, then it will make health better? But one thing I can tell you, that if you have healthy people, you can have a healthy economy.
Let's just leave it at that. And that is a very wonderful input. Thank you very much, Rama Monya. He's from the Civil Society Budget Advocacy Group. Let's run a short break. We'll be right back with Mr. Ndebesa Mwambutse, a political science lecturer at Makerere University. Welcome back to Morning at NTV. My name is Romeo Busiku. In studio, I do have Dr. Olive Komusinje. She's the author of The Patient, a book that highlights the plight of medical workers in Uganda. I also do have that is Professor Ndebesa Mwambutse. He is a political science lecturer at Makerere University. Very good morning once again. Now, Mr. Ndebesa, we are discussing Heroes Day and what it means to our guests. Were telling us what it means to them. Well, in the Ugandan context, well, we remember those heroes who sacrificed everything to ensure that we enjoy the peace that we're enjoying right now. But then, in your own words, what does Heroes Day mean to you?
Broadly speaking, let's somehow give a broader definition of a hero.
Go ahead.
By and large, a hero is not necessarily the one who kills or fights or brave or whatever, although that could be. But I think a hero is somebody who turns the lives of humanity around. The one who makes a difference in human lives, whether he is fighting or she is fighting or is not fighting. It depends on what you have achieved for humanity. Because other heroes were not necessarily those who were fighting. And for example, there is a big COVID-19 hospital that has been constructed in the UK named after Florence Nightingale. Florence Nightingale was a heroine during the Crimean War in, is it 1850-something?
Indeed, yes.
Yes, so that one is a hero. Edward Jenner, who discovered vaccination, is a hero. Louis Pasteur is a hero. So heroes are not necessarily those who have taken up arms, although even those who have taken up arms. And there are those even heroes who have become heroes because they have turned around the history of humanity, not necessarily by fighting, but by advocating for peace. Martin Luther King, Desmond Tutu, Mahatma Gandhi. These are heroes in their own way, as much as even those who fought are heroes. So let's not tag heroism and heroism to fighting and being brave. No.
Whom are you celebrating today?
I beg your pardon?
Whom are you celebrating today as your hero?
Celebrating? I think we are commemorating. I don't believe in celebrating Ugandans killing fellow Ugandans. Let's not celebrate people killing fellow Ugandans, people killing each other.
Not killing in the sense we are celebrating the medical workers who are on the front line of the fight against...
No, the Heroes Day for today, why it is marked and commemorated today, is not because of frontline workers, the Heroes frontline workers. It is those who fought in the bush. But we are expanding the definition and meaning of hero to include the Heroes workers, but also those who fought. Today, commemoration is basically around those who fought. I don't think it was around those who participated in Harris. Well, but even those in Harris are also heroes.
Well, the NMG today has decided to actually highlight the might and the plight of health workers. And we do understand 22 of those health workers who are on the front line have gotten infected. And we'd like to know from your perspective, what can government do to protect health workers so that they can go ahead and do their work without any problem?
Although we have to remember other people who have participated in Harris, in Harris, not necessarily even Harris workers. I mean, even a person like Mongore Lutaya contributed a lot in sensitizing issues about AIDS. We have Dr. Rukuya, who died, and the nurses, by the way, we normally highlight Rukuya, but there are nurses also who died.
11 nurses died.
11 nurses died who were treating people because of Ebola. So we have very many Harris workers and unsung heroes and heroines who have died even and they are not highlighted. So if you want to bring it to today, in respect of COVID. I think when we talk about frontline health workers, we not only think about the doctors. They are doctors, yes, but they are also other scientists. There are other auxiliary workers who are all contributing towards the cause of reducing the spread of COVID-19, as well as treating patients of COVID-19. Because we should actually sing the heroes who are treating, but let's not forget about those who are preventing.
And of course, the heroes who are on the front line, most of them are women, majority. During the World Health Worker Week, we noticed that 80% or 70%, they were women on the front line. Now, is this a chance for the world to kill patriarchy when COVID-19 is done away with?
Apparently, even here in Uganda, the Minister of Health is a woman, and the Permanent Secretary is a woman. Those are
is this a chance for us to kill
those are the
patriarchy?
Commanders. Yeah, of course, even in our traditions, women have been very much at the front line in managing health and managing patients. Even those who manage patients at home are women, and those who feed children, because health is not about disease as causate, as microbes causing the problem, but we have got even malnutrition. It's a question of disease, and patient care is done by women, but because of patriarchy, you might only, even when you talk about doctors, sometimes the co-singers are not doctors. You know, according to our health mind, it seems as if doctors are only men. But here we are saying, let us look at both genders in respect of how they have contributed a lot to saving lives and humanity in general. Yeah, yes, today we should also sing the unsung heroines. Because we are even using the word hero.
Indeed.
That is itself a patriarchal terminology or a gender-insensitive terminology, because we are not talking about heroines, because women heroes are not called heroes.
Dr.
So Heroes Day should also be called Heroes Stroke Heroine, if we have to be gender-sensitive
Dr. Kausinje, as we wrap up, do you think this is a chance for us to do away with all the gender inequalities that we've been seeing, now that we now understand that women can do most of the things men can do?
So that would be wonderful, but I think it would be naive of us to think that the COVID-19, horrible as it has been and as it's being, that it's going to actually change that. I think that it needs to be more deliberate, and I think there is a risk right now that some of the things that are going to be entrenched are negative. So I haven't seen anything that would indicate that patriarchy is about to go away, because we've suddenly realized that, 80% of the health workforce are women.
So that means the gains we've made during this pandemic will go away. Is that true?
Come again?
Does that mean that the gains we've made during this COVID-19 pandemic will go away after COVID-19?
Well, for starters, we haven't made nearly as much gain as we could have, and I think we've also lost a bit. So I think we need to be careful to harness all of the gains that we could. But I think we also, and we keep coming to this point, and I think somebody in Mulago mentioned the same thing, that, you know, COVID-19 is going to make people sick. Maybe a few people might die, but there are lots and lots of Ugandans that are sick from other things that are probably not getting as much care as they should. They're going to die. Malnutrition is going to increase, has increased as we speak. So I think we need to look at this in totality and look at health in totality and not just focus on a virus. Thank you very much,
Dr. Olive Kobusinja. Look at health in totality, and also Professor Ndebesa Mambutse from Makerere University. Thank you very much for having made the time to speak to NTV. Now I'm absolutely sure you do know who your heroes are, the health workers. My name is Romeo Busiku. Have yourselves a blessed day.